Hello. So today I'll be demonstrating how to instill eye drops for our children. Now first of all, whenever we have an eye drop, do check the expiry date. Expiry date is written at the bottom here, and usually any eye drops expiry date is 2 to 3 years from the manufacturing date. But please remember that once we open an eye drop, any eye drop expires within 1 month of opening. So whenever you open the drop, write the date of opening to prevent expired drops being instilled in your child's eye. Now, this is a general eye drop, and I'll just demonstrate you how to open the eye drops. Now, when you buy the drop, just see that it is sealed like this. It should not be open. It should not be dirty on the outside. And once you open the eye drop, you have this ring here. Okay, this top you should keep it carefully. Remove the ring in such a way that you don't touch the nozzle of the drop, because that is where the is going inside the eye. And then if you notice, on the top of your cap there will be one small protruding thing that will go inside the dropper. So once you make it tight, it will go on the head of the dropper and it will cause a hole to happen and the drop will come out. Many drops have a mechanism which is there on the inside. Suppose this fails, suppose you see that okay, this is not opening, then you can take a sterile needle. Injection needles are available in all pharmacies. You can take an injection needle which is sterile, so just open it and poke inside. But mostly if your dropper doesn't have that cap and a protruding end inside that cap, do not use that drop. Ask for a new drop which has a sterile protruding cap. And always cap your drop after instilling. Make sure that the tip is not touching here and there. If you touch the tip somewhere on the face or on the hair, then the bacteria or microbes can come on the tip and it can contaminate these drops. Now please remember, when you store the drop, store it in a cool place or room temperature place away from sunlight. Most of the eye drops do not require refrigeration unless your doctor asks you to refrigerate. So there are certain glaucoma medications which require refrigeration. So they will be asking you to follow the instructions, but most of the other drops you can store it outside in your room temperature. Just it should be away from the sunlight. Preferably if you can put it back inside the box is better, so that it is sealed and it is away from outside contamination. Make sure whenever you are instilling drops, you should wash your hands properly and clean the hands and then touch the eyes of the patient. Sometimes if you are alone in an adult, we can put drops on our own, but our eye should be clean and our hand should be clean, and then you can take support with one finger on the cheekbone here and then instill the drops. This will make sure that the drop doesn't come too near or too far from your eyes. So take support on your cheekbone and then instill the drop. Now I will be also showing you how to put drops in children. In children it is a challenge. No child likes eye drops, but there will be some tips that you will learn to better handle eye drops in children. Thank you. So I will teach you how to put eye drops in a child. Stable your hand on the cheekbone of the child and put the drop in the lower area. So just retract the lower lid and put one drop in the lower punctum. If the child is very fussy, then put a drop on the corner of the eye and open and close the eye for the drop to go in.